Hello, my name is Mira Ghanem, and I'm an assistant professor of trauma and acute care surgery at R. Adams Cowley Shock Trauma at the University of Maryland Medical Center. I would like to start off by thanking EAST for selecting the Brain vs. Bone study as the winner of this year's Multicenter Trial Junior Investigator Award. Traumatic brain injury is a major healthcare-related problem in the United States, and TBI is most commonly associated with long bone fractures. Recently, it has been shown in animal models that long bone fractures in the setting of a TBI worsen early neurologic recovery and subsequent learning and memory. Early stabilization of long bone fractures is associated with favorable outcomes, and while some groups advocate immediate definitive fixation with intramedullary nailing or open reduction and internal fixation, others support the concept of damage-controlled orthopedics with temporary stabilization with external fixation. The optimal method and timing of long bone fracture fixation in the setting of TBI remains not very well understood. Given the risk of adverse neurologic sequelae in the setting of an associated long bone fracture, and in moving towards identifying treatment strategies in the TBI patient that improve outcomes, it becomes essential to establish a better understanding of the neurologic sequelae of the different fracture fixation modalities in the setting of TBI. The aims of the study are to determine whether the type of lower extremity fracture fixation modality influences cognitive outcome as it's represented by the Rancho-Los Amigos score at discharge, discharge GCS, and motor score as compared to the admission GCS and motor score, and additionally whether timing of fracture fixation influences outcomes. This is a prospective observational study where patients who are greater than 18 years of age or older with a GCS motor score less than 6 within 24 hours of admission, a head AIS greater than 2, and an operative lower extremity fracture can be included. Those who are determined to be non-survivable on admission, prisoners, parolees, those on probation, and pregnant females are excluded. IRB approval per participating site is required. Decision and timing of operative intervention is based on the standard of care at the participating facility. The fracture fixation groups are divided into XFix, IM nail, and ORIF in the setting of mild to severe traumatic brain injury. Participating sites must utilize the Rancho-Los Amigos tool as the primary cognitive evaluation tool for traumatic brain injury patients. Data will be collected over an 18-month period and uploaded onto the AAST data collection tool. For any questions, please feel free to email me at brainversusbone@gmail.com, and I look forward to collaborating with you.